So this is our spinal column, looking at it posteriorly or from the back. This is our head. This is our pelvis. And now we are looking at it from the front or anteriorly. So the job of the spinal column, that it is the central axis of the body. It also connects and integrates the actions of the entire body because it connects the legs, the hip, the rib cage, the shoulders, and the head. It also protects the spinal cord, which is this yellow thing, down till L2. The spinal cord ends at L2 and continues as nerve roots called cauda equina. And the spinal column also protects the nerve roots as they exit between each vertebrae. Unique to the cervical spine, that the spinal column also protects the artery to the brain, because these things to the side are called transverse processes. So in the cervical spine, they also have a hole in these transverse processes called transverse foramen, and this is where the artery to the brain runs. And so we have 7 neck or cervical, 12 thoracic or mid-back, and 5 lumbar or low back vertebrae. We also have the sacrum, which is 5 vertebrae fused together, and the job of the sacrum is to support the spine and to transfer force from the legs through the hips to the spine. And then lastly, the spinal column ends in the tailbone or coccyx, which is 3 to 5 vertebrae fused together, and the coccyx attaches to the sacrum via the sacrococcygeal joint. And this used to be our tail. This is where our pelvic floor muscles attach, and it also has a supporting and stabilizing role, because when we are sitting upright, we sit on our ischial tuberosities, which are the sit bone, but also the tailbone has a supporting role in this. It stabilizes us just like a little tripod. So also the sacrum has a very small movement called nutation and counter nutation. Nutation is when the sacrum tilts forward and then the tailbone tilts back, versus counter nutation is when the sacrum tilts back and the tailbone tilts forward. These are the discs between each vertebrae. They are a lot larger towards the low back versus very small in the cervical spine. And then the disc acts as cushions or shock absorbers between each vertebrae. And unfortunately, they are a very common source of back injuries, especially in the neck and low back area. As I said, these are the transverse processes where ligaments and muscles attach. And as I said, the transverse processes are unique in the cervical spine, as they have a hole in them where the artery to the brain runs through. And then these guys are the spinous processes, which look different in the low back versus thoracic versus the neck. And this is also where muscles and ligaments attach. And if you're looking at it from closer, we can see that in the neck, they are relatively short, relatively thin, and they have this split to it, so they called bifid spinous processes, versus in the thoracic, they are longer, they also have a steep downward angle, and the low back, they kind of thicker and relatively shorter. And each vertebrae has 2 upper or superior and 2 lower or inferior facet joint, which are these guys. So the facet joints allow for movement, but based on their shape, they also limit movement. So in the low back, the facets face each other like little ears, versus in the thoracic area, they are at a steep downward angle, versus the neck, which is still angled downward, but not as much as in the mid-back area. And as far as range of motion, we have the most range of motion in our neck, followed by the thoracic spine, which has also good range of motion in all planes except in back bending or extension. And the low back, because of the way the facets are shaped, has very good range of motion in forward bending, back bending, side bending, but very limited in turning or rotation. And lastly, a couple joints in the spine. Up here we have, this is the occiput. This is the first vertebrae called atlas. So this is the atlanto-occipital joint, versus axis, the second vertebrae. These two guys have names because they are unique. I will talk about it in a separate video about their uniqueness. So this is the atlanto-axial joint. CT junction is where the last cervical and first thoracic vertebrae connect, and C7 is where that large protrusion in the back is, which is usually easily palpable. We also have the thoracolumbar joint, which is where the last thoracic vertebra is and the first lumbar vertebrae starts, and the SI joint, which is where the sacrum attaches to the ilium. Sacrococcygeal joint is where the sacrum and the coccyx attaches.